There are places in Bolivia that time forgot. Just 2 hours out of Santa Cruz, the small town of Palacios is one of them. But that is where students and residents from the Northwestern University Feinberg School of Medicine went this year to serve out their Global Health Initiative internships. The Centro Medico Humberto Pará is located in the Bolivian rainforests. Since its founding in 2001, doctors there have seen over 20,000 patients from the surrounding 12 local communities. The clinic depends on volunteer physicians and healthcare workers from the United States. Dr. Douglas Villarroel has been there since the beginning.
We are the second poorest country in Latin America. Thousands of people do not have health care, especially in the countryside. We started this clinic in order to provide health care to people of extreme poverty. We not just provide medicines to them, but we try to educate. We talk about nutrition, we talk about changes in their style of life, and there is where we make the difference with the patient.
Many of the ailments are common to the area: dysentery, diabetes, headaches, and stomach problems. The Northwestern students take medical histories and get valuable experience in hands-on diagnosis. The medical students work alongside attending physicians, treating a large variety of ailments in patients who cannot travel or afford treatment at the larger city hospital.
It was bigger, it had grown, but it wasn't hurting her as much.
Okay.
It was still hurting to swallow,
Right.
but she hadn't had fevers.
Dr. Jerry Liu, a resident from Northwestern, has to take matters in his own hands to drain the abscess.
So we just had a 46-year-old lady with a history of several neck abscesses which have occurred within the last 2 years or so, who came in today with worsening of what appeared to be a neck abscess. Yeah, in this location, this is tricky. No one ever likes going into neck. The area was clearly inflamed, and there is clearly an area where pus had built up beneath the skin. We were able to take care of the abscess, do the incision and drainage, get the sample for culture, and follow up with her next week, all for no cost to her.
So right now we're on the road from the clinic to Portechuelo.
When a problem arises that can't be handled at the clinic, patients are sent to a nearby hospital in Puerto Chuelo. While clinic care is provided free, hospital stays often require families to pool their limited resources to cover a loved one. Chris Bowden is going to check on a woman he sent over last week.
Okay, ¿cómo fue la cirugía?
Bien, gracias a Dios, todo salió bien.
Ajá.
Sí, la señora María la topé aquí, ella me ha ayudado con los medicamentos.
Sí,
Le agradezco mucho.
yo sé. Es que no hay recursos para todo el mundo, pero estoy feliz que fue bien para usted. Suerte. Gracias.
Getting to know patients one-on-one, practicing in a real-world setting where you can see immediate results, gave fourth-year medical student Andrew Reed a new perspective on his chosen profession.
I think the opportunity to do this is really something that every student should try and do if they can. I mean, it's really a pretty unique opportunity, and it's something that is really amazing that Northwestern has and that the Global Health Initiative has provided for us. I mean, the clinic here, for example, is something that really wouldn't run without students and without residents from the U.S. At times it feels like I'm in Chicago when I look around and see the people who I've been on rotations with in the States, and it's pretty neat. I mean, we really brought like a piece of Chicago, Northwestern, and Loyola here, and hopefully we'll be able to continue to do so.
Since 2007, the Global Health Initiative has sent medical students to places like South Africa and Central Asia, Jamaica, Togo, Nicaragua, and Belize with the same goal: to help impoverished sick people in areas with limited or non-existent healthcare resources. At the same time, this work is inspirational and even life-changing for the students. It allows them to learn about different cultures, even as it strengthens their professional skills and deepens their compassion. So the care they provide for all of us someday will truly be the best possible care in the world.